Hello, everyone. I am Dr. Hope Watts, board certified family physician, health coach, speaker, author, and lifestyle expert. So, we are coming today to discuss wellness and heart health. But in the meantime, we want to send our prayers and our thoughts to all the people in the state of Texas due to the catastrophic things that happened in their state. As you know, they had a major snowstorm or ice storm, and their grid was not able to increase capacity for all the people who wanted to increase their heat. And I believe that because they didn't have enough electricity, then the water treatment plants suffered also, and so many people did not have any heat or water that was healthy to use. And many people were, in a desert. Really, there was nowhere to get extra water or extra groceries. So we want to, send our prayers to them, and we want to help them in any way we can, because I can't even imagine how severe the symptoms or severe the circumstances are, because everybody's circumstances are different. Many had ice, pipes break, and even if they get their water back, there's going to be a lot of cleanup also. So we want to send our prayers to them, and we want to help them in any way that we can. So today we're going to talk about heart health and wellness. And it's going to be a little different than what we talked about last time, but we talked about being optimizing our health in any way we can. And that requires us to take stock about what we do on a daily basis. We did challenge you to see if you could walk back 15 minutes a day and increase your water. Maybe not the 8 to 10 glasses, but maybe 4 glasses. And so we hope you were able to do that and realize that there's benefit in it. Some of these things that we're asking you to do, you don't see the benefit in it until years later. I remember there are some patients that I've had. Hi, Jillian, how are you? Glad to see you today. I had a patient in my practice who was in her 60s, about 62, and she was very slim, very trim, very agile. And I asked her, I said, how do you stay that way? She says, I cycle like 30 miles a week. And I'm thinking to myself, she's 60 and she's cycling 30 miles a week. That is more than enough exercise to keep your body, your heart, and the rest of your body in shape. So there are a number of people who are working on that, and evidently she liked to bike ride, and she did a lot of long distance bike riding, but it doesn't have to be that. It could be something else. We recommend walking because it's easy on the joints, but as you can see, as we continue our talk, you'll find that there are other things you can do to move and stay active and do things that you enjoy. So last week, we talked about actively participating in our health habits so that we can optimize our health, no matter whether we had health conditions or not, and thrive rather than just surviving. And people, you ask people how they're doing, and they say, well, I'm doing okay, but what does okay mean, really? Okay, as I just said. You can also have physical health without enjoying physical wellness. Um, Even though you're not suffering from a major illness such as high blood pressure or arthritis, it does not mean that your body is in top physical condition. Um, we talked about, starting about 15 minutes a day. And for some people, that's a lot because they don't do it on a regular basis. And many people feel that, hey, I get out my car, I walk into the door for work. That's exercise, that's movement, but we're talking about continuous movement, not stopping and starting. There is a consistent association between weight gain and health problems. And these problems are usually chronic, and they include diabetes, heart attack, stroke, sleep apnea. That's one that has come on board now as a result of people having a little excess weight. There are some newer findings about staying overweight or carrying excess weight. The cardiologist did a study on men who were in their 40s, 46 or so, and what effect it had on their lifespan. They found that people who stayed with excess weight shortened their lifespan by 60 years compared with those who maintained their normal weight. Now, one thing they didn't do in the study, they did not look at people who were 46 or 45 who had been overweight for a while and then decided to lose the weight and measure how long they lived. Many diseases such as sleep apnea, joint pain, and arthritis occur a lot of times, and not always, as a result of carrying excess weight. The other thing we need to discuss is where the fat is located. Some people have fat located on their hips, and they have this kind of an hourglass shape. Others have this, extended belly. If the fat is stored around your waistline, just above your belly button, that's in the abdominal area. That fat, usually, you can't see it though, usually wraps around your pancreas, which is the organ that produces insulin to help you manage your blood sugars, the liver, and other intestines. And it is usually associated with some of these chronic illnesses. It also shows that this type of fat, some of the research also shows that this type of fat can worsen your chronic diseases. Now, here's a test for you. A lot of times patients are asked to undergo surgery, and the cardiologist or the anesthesiologist's concern is whether a person can walk up a flight of stairs without getting excessively fatigued or tired. Can they walk all the way up the stairs and not stop to rest? Or can you walk a few blocks in the city and not be excessively tired, having to stop several times? These tests show whether you are physically fit or not. And if you can't do these things, you should really check with your doctor to see if you could undergo a strenuous, more consistent exercise plan to get you in better shape. I can't tell you how many people have come to me and said, I'm tired all the time and I can't really get anything done. As soon as I get up, I'm feeling tired, I'm dizzy. And then you ask them, well, how much exercise have you done? And they'll say, I don't do exercise. And then, you mention the fact that they are deconditioned. And I say deconditioned so that people won't think they're out of shape. The term out of shape just has a really bad connotation to people. And they're like, no, there's something else wrong. I had one person in particular who wanted to see cardiology. She wanted to see endocrinology because she thought her thyroid was out of whack. And we were telling her that seeing all those specialists wouldn't necessarily change her being out of shape, but she didn't want to hear what we had to say. So we sent her to all these specialists. And the answer came back that no, there was nothing wrong with her thyroid. And usually there's not, unless there's some other issues. And we actually sent her to cardiology. Cardiology didn't really want to see her because they didn't think anything was wrong with her based on what I had told them. We sent her to cardiology. They did, and she wanted a stress test. We did the stress test. She was fine. She passed the stress test. So she was really deconditioned. And that's one of those elements of wellness that we don't look at. And so it's important to have a certain amount of exercise built into your daily schedule. And this is one of the things you can do to really improve your health and your heart health. And if you are carrying excess weight, the good news is our bodies are really adaptable. We can actually change the course of where we're going. I can't tell you how many patients have come to me and said, look, I don't want to go the way my mother did. I don't want to die that way with the 15 pills that she took, and she didn't even know the names of them. So the good thing is that there are ways to prevent certain diseases and to maintain a healthy lifestyle. Being physically active is a major thing that you can do to help that. And it doesn't just help heart health, it helps the arthritis because they recommend exercise for certain arthritis. It helps with the prediabetes because there are lots of research that shows exercising actually can prevent people from going on into diabetes within reason. Most of this is not just exercise alone, but it is with a special diet. There are several types of exercise that we recommend for good heart health. And these types of exercises are cardio, or some people call it aerobic exercise. And these exercises improve your heart, give your heart a lot of strength, and it makes you feel better. So we're going to talk about which ones you can probably institute. Now, we told you about walking last week, but there's so many other exercises you can do. And some people don't like walking. There's some people say, oh, Dr. Watts, it's so boring, and I don't want to be on a treadmill and I don't want to do that. But we try to find something that our patients enjoy so they can do it every day, or at least do it every other day. What does cardiac exercise do for us? And what benefits it has for people who already have like high blood pressure or diabetes. So it lowers your blood pressure and your heart rate. And many times that's one of those parameters doctors look at. It increases your overall fitness. That means you're going to have the energy you want to do the things you would like to do. It helps cardiac output. It helps you, the heart pump out the right amount every time. It reduces your risk of diabetes, of course. And if you're living with it, it helps you control your blood pressure a lot better. And it does the same thing for high blood pressure. It keeps your blood pressure down. So as sometimes with hypertension, as you progress on, it can get higher. And if you're exercising on a regular basis, that means you're losing weight. It may not be that way. Usually the recommendation is at least 30 minutes, 5 days a week. And the total for the whole week should be minimum 150. If you want to up that ante, by all means do, because you're going to feel better in the long run. And if any type of procedure needs to be done, you will probably sail through it with very good results. This type of exercise can be in the form of brisk walking, as we talked about, swimming, jogging, running. We can also do bike riding. I like bike riding. Where I live at, there are a lot of bike routes and bike trails. So a lot of times you don't have to worry about the cars coming or people who are walking their dogs. It's strictly for bike riding. And you can get in a lot of miles that way. The other thing is that you can do is take the whole family on a walk. Kids love to get out and burn that energy up. Another thing is Beachbody. Beachbody, I don't own any stock in Beachbody. I'm just saying that they are good exercise routines for those who want to do something different, like P90X. And I think Shaun T had a 30-minute exercise. Now, just remember, these exercises are very strenuous. So start out with something less strenuous than that. The other is Zumba Fitness. A lot of people like doing Zumba, and it can help you lose weight. So I have a funny story to tell you. I had a patient once who was diabetic, and she had hypertension and high cholesterol. But on one unsuspected day, she had bought some new boots, and she was showing off her boots and fell, and she broke both of her ankles. Oh my goodness, it was a really trying time for this patient. And I had already told her to lose weight. And after that happened, I didn't really have the heart to tell her again she needed to lose weight, because I knew she'd have to use her feet and her ankles, and I knew they were painful off and on, and she was having difficulty with that. So I continued to see her. And one day she came in. I said, well, Miss So-and-so, you've lost like 20 pounds. And she said, yeah, I have. And I said, well, how did you do it? She said that she had gotten a DVD that had all of the line dances on them. So one day she would do the Cuban shuffle for an hour. The next day she would do the wobble for an hour. And then she would go on to electric slide. I don't remember all the other ones, but she lost 20 pounds. Now, she had 2 broken ankles. And I said, well, does it bother your ankles? She said no. So there are all kinds of exercise you can do for weight loss. So it doesn't have to be the ones that I said. Hiking is another one. When I've gone hiking, I have lost weight just from, because it's a more of a strenuous type exercise. And if it's in the summertime, you definitely burn up a lot of calories. Now, we're going to talk about strength training. Now, the good thing about strength training is, and a lot of people don't realize this, they feel that they don't want to do it because they'll be muscle bound. They don't want to be like a bodybuilder. But for women, we recommend weights that are not heavy. Starting out with 3-pound weights is excellent to start, because you can get more reps in. And really what we want to do is build the muscle. Build the muscle in such a way that we'll burn our calories more efficiently. Now, the good things about resistance training is that it increases muscle mass, but not in the way you see people, the buff people and the people who are in the gym all the time. This is to build your muscle mass, and you may not have as much as everyone else. Muscle mass gradually decreases over time, and strength training will help that and reverse that trend. It increases bone density, and that's more for older women who need to exercise anyway. And it helps them, maybe not have as many medications to take for their bone density. It increases joint flexibility. It helps the joints. It reduces the symptoms of arthritis additionally, and it helps with weight control. There used to be, I think it was a DVD or video that says lift weights to lose weight. You can actually lose weight just lifting weights. And that's for women, especially if they do not have they're not able to walk or run or do some of those other exercises, or even do the electric slide. They can, lose weight with a good, healthy diet and just lifting weights. They can do that. And it helps with balance. And they want you to do 20 to 30 minutes 2 times a week. The other type of exercise that we're going to talk about, it's not really the type of exercise that will help you lose weight, but it'll help keep your muscles flexible so that you won't injure yourself. Many of these exercises include just stretching, stretching your joints, stretching your muscles, especially the muscles in the back of your legs, which are your hamstrings. They can sometimes be very tight. The stretching is critical to helping you when you're doing your resistance exercises, so that you won't injure yourself or overdo it. And it is recommended that you do it every day before or after your exercises. And some people, they don't have to do it that often. They can do it like every other day just to keep their muscles flexible. But if you're doing something strenuous like running or jogging, you probably want to do them a little bit more You can find these exercises on YouTube. YouTube has a lot of exercises of different types on there. They have them on Amazon Prime. You can get DVDs for them also. But the main thing is finding something that you enjoy, something that you like. And a lot of times it's the music that you exercise to. Because some music you get a rhythm going and you can move your muscles in a certain way. So we hope that our talk on wellness and heart health has given you a different perspective, because a lot of times we tell people to exercise, but we don't tell them why and what benefits they're going to have. But thinking about your heart and your wellness and how well you want to be in the years to come is very advantageous. Now, some of us have people in our family that have lived very long. I know my grandmother, my grandfather was in his 90s when he lived, but he did a lot of strenuous work too, and he ate pretty well. So we want to have long life so we can enjoy our families, enjoy our children, enjoy our grandchildren, see them grow up and get married. So it's not just about just exercising. It's because we want you to enjoy life also. We want you to be there to experience those things that that everybody wants to experience. And not there are people, I have people who, sometimes get depressed because of their chronic illnesses, but there are ways to get around it. So we hope this was enjoyable and we gave you some points and we gave you a different perspective this time about what wellness and heart health means, especially since this is National Heart Month. So if you have any questions, feel free to ask them right now. And if not, we will adjourn for the day, but keep the people in Texas in mind, and keep them in your prayers, because I don't even know the magnitude. I was talking to a recruiter the other day, and she lived in Texas, but she was fortunate. She lived down the street from a hospital, and I guess they had helped, had more electricity in that area, but many people don't. Just remember that. So I am Dr. Hope Watts, board certified family physician, health coach, speaker, author, and lifestyle manager. You can find me on Facebook, Instagram, LinkedIn, and Instagram and Pinterest. So remember, I'm coming up with my book. I will give you the title of that in the next few weeks. So stay tuned, and thank you for your ears and your listening today. Have a wonderful week. Bye-bye. Bye-bye, Jillian.